Okay, on a question on a cabo, these are the Bodi, Betteh Gentri program. When I Sierra Leoneans them around the world, and they build this program together. Everybody within the house where they present this program, nobody know they get paid. Most of them can join me in the past, so I don't meet the team. Because of time, I'm not going to go through the whole team, but if you except for know what I day at the team, please let we know. I will share with email and with phone number. Get in touch. We will show all the people that are on the show and wait for them. Fill them with and qualify in. Me, my name is John Fuller, and I'm on our host today. And like what they say before, when the show starts, I'll therefore mute everybody. Also because I don't want to let people participate, but it's because we want to let the person with the presenter do the show uninterrupted. Okay. So now we can begin today. Now the 41st session, now 41 session now don't do so far. We begin last year, we don't pass over 1 year. And today, now Sunday, the 28th of November 2021, and Dr. Christian Bεll, now they present to it today. They talk about Pekin business, basic reproductive medicine. Basically, we can't tell we how Pekin they get conceived, you know, in what situation they whether they can happen, and situation they way, you know, thing they can happen, ways something they not can happen, or you will get issue for that happen. They have a family them this program not they pick on any individual. So any example then give not say, oh, now in a meeting they talk about no. Generalized advice with the give for let people are able to know waiting they for look for by their own body and when them for seek medical advice. Do you continue for use your medical professional, your physician or your GP or whoever you see? Yeah, so they will kind of for break down the explanation on medical conditions. So you'll be able to know when for seek advice, but when they provide any personalized advice. Now, not to say we don't want to do more, but because the reason we couldn't do them, we not get the background of your medical history. We not do tests and examinations for able to know waiting they go on with you and for able to give you the best advice which will be suitable for you, the individual. Okay. So as I be say, we are a group of Sierra Leoneans. Nobody know they get paid. Nobody they get paid in any way, shape, or form. In fact, most of we now they put with money into plus time and resource. Now they go into everybody don't study in various fields, but we look and see it better law to do this program for them we will benefit with people them not alone. Okay. So that's why they say the program will record it will be available on YouTube. And also today program most likely will be on Facebook Live. So I'll be done share the Facebook page before. I will share them again in the chat. So if anybody interested or maybe you get groups the way you belong to, you want to share them with people, then please feel free. And also you can get in touch with me via WhatsApp at the number down there. If you get onto we on WhatsApp, you can even add in our own WhatsApp group. The WhatsApp group now admin number the post so people not go for the post boku junk. Now only thing that we concerning the program now we put there. And not all the time something in I want to say week 9 or something we did or let something when a medically important stuff come up and we will put on there. Okay, so if you're interested, please WhatsApp that number there and we'll join you in the group. Okay. Okay, like I said before, at the end of the program, we'll give people enough time for ask. If you want to ask questions, now this you for do. If you look at the bottom of your phone or your laptop, you will see then 3 dots here. So if you click on them 3 dots in there, you will see this page. If you go on the chat, you can chat and talk, ask any question you want to ask, or maybe make a comment, you can put them there. But also, if you want to ask questions, some of we will not ashamed, some of we will be bold enough for talk. Because some man they shame or something, some man it can be noisy. So it can put in question at the chat. However, if you want to ask a question, you want to come on, please raise your hand. We know the dealer, everybody just talk no more left, right, and center. One make sure say it get done orderly. So if you raise your hand by that way, we will come to you in order. Maybe basically first come first serve. And also, if you are not physically, if you're not able to use the tool, if you are not physically, if I see you and I will come to you. Dear me family, if I not see you, not mean they ignore you. But I will make sure say I come to you. We'll make sure we try to take as many questions as possible. So now my family, thank you. Without further ado, I will hand over now to Dr. Bεll. We will take on our session today. Dr. Bεll, when you're ready, I'll go on mute you, please. Okay. Yeah, I'll ask for mute.
Okay. So, my family, good evening. My name is Dr. Christian Bεll. I'm in Germany, stay and work in Germany for a fertility center. Hanover and Wolfsburg, and me also a consultant for a Sierra Leone-based virtual medical consultancy, the Arrest Medical Consultancy. Thank you today. We give me the opportunity for talk to Ona about basic reproductive medicine and infertility through Bodi, Betteh, Gentri. I will talk small about Bodi, Betteh, Gentri. Bodi, Betteh, Gentri are a very, very good and very successful group. We myself able to join this year through recommendation from a very good friend of mine, and are really blessed for being at this group here. So because I mean the way how we able to bring medical health information and other information, other issues to the Sierra Leone public in Sierra Leone and in diaspora, make this group as a very, very important group. We did try for able for expand we coverage na Sierra Leone. As Dr. Fuller don't say, they're on Facebook Live, but we also try for go on air in Sierra Leone through TV and radio next year, if it's possible. So if we get any sponsor, or any TV or radio station we're interested, then you can also contact Dr. Fuller or Mr. Fuller. So, well, Bodi, Betteh, Gentri don't allow me for talk on this topic. I not get no conflict of interest, and most of the diagrams, because I therefore do most of the presentation in diagrams, and most of the diagrams then are from the Mark Atlas of Reproductive Medicine at Poland. Where would they talk about basic reproductive medicine? I mean, for actually, not to actually Bεtteh woman business, now more on how for make the woman get Bεtteh, and the reason that why make some woman they not able to get Bεtteh. The topics that I will talk on today, I will start with the male reproductive organ, then I go to the female reproductive organ. I talk about the menstrual cycle, the period where the woman then can get, and how woman can get pregnant. And then also I will define with infertility. We'll talk about the causes of infertility, then how we able to prove why make one woman, the man or the woman, not able to get, for make the woman gets pregnant. And we were able to see, I'll talk also about the prevention and treatment of this problem. But before I start, I want know what's in our hormones, because I'm most likely I'm going to talk a lot about hormones, and I might get for they change some words them, but before they change the words them, I will explain to Ona the word, and then I might change them. Like for instance, the hormones, we will say that are messengers, then at the body, will be produced by the body, and then they travel to other parts of the body, and then they control other parts of the body for make the other parts of the body they work. And the common one we will all go know, like insulin, for instance. Insulin now also a hormone, where the one day where somebody, where for instance not get we get diabetes, and they get for inject themselves because they're not getting enough insulin. But when it comes to reproductive medicine, insulin also can play a role on for that. But the main hormones them for the reproductive medicine, now the follicle stimulating hormone, I would call it FSH, and they get the luteinizing hormone, I would call it LH. You get the estrogen, then I would call it the woman hormone. Progesterone, we would call it the pregnancy hormone. I will explain to now why they call it pregnancy hormone, and the testosterone, I will call it the man hormone. But instead of I say hormone, most likely I would say messenger, so that you will understand that more, which I mean. So enter I say messenger and the hormones that they talk about. So let's start with the male reproductive organ. The male reproductive organ, if you look at the diagram, the parts where we see women naked now the penis and the scrotum. Yeah, but you got other parts them that is male reproductive organ where we know the C. Yeah, part of the penis we also know the C, and then you get a lot of tubes they want to see. I'm not going to name them all one by one because it will very difficult for me to understand. But the main thing I want to understand is that if you cut this, you get inside the scrotum, you get what they call testes. And these testes, if you cut her open, that's how you look. You get small tube them. The tube they call them pipe them. Small pipe them, where they run inside these testes, and then they all cut up, then join into one pipe. And this one pipe now, it goes through, they go up to the bladder, then it goes through the prostata, their organs now, so now you can give the sperm them like a food. And then you have to go through the penis before the man is able to ejaculate this sperm out. Inside, if you watch the tube there, so if you draw a long one, now about 300 meters. Yeah, so if you imagine, if you want round stadium now 400 meters, so if you take the two and test system, you draw the tube, the long one, almost the round stadium to 10, at least the round stadium 1.5 10, for know how long then tube they are. So and inside the tube, then if you watch inside the tube, then cut the tube open, that's how it look. And inside the sperm, then they produce the sperm. This sperm they be produced. And the sperm then, now so they look, then gets head, then gets the middle piece, the neck, and then get the tail. And then very small, you don't actually see sperm them. In past moment, you use microscope before they're able to see the sperm them. So now the one thing that you get to know for the reproductive, the male reproductive organ, say the sperm, then it be produced inside this long tube, yeah. And this tube, and when they put it inside this tube, it go into they be collected into a single tube where that they after the man gets sexual intercourse and ejaculate, it go through the penis and it will ejaculate preferably inside the vagina of the woman. And there are millions of sperms that need to be produced at once. So if man ejaculates, the one ejaculates where they come out. Now millions of sperm then they come out. But we'll talk about that also later. If you come to the female reproductive organ, the female reproductive organ is divided into the vagina, as in the penis, the man can insert in penis, and then you get the cervix, the small opening into the uterus, and the uterus now the womb, we can call the womb, and the uterus consists of the muscle, and then it gets also to what they call the endometrium. The endometrium, we will call it carpet, yeah, like a carpet with the inside, the line inside the womb. And this carpet is very important. We get for talk about that later. And then you also get the fallopian tube. This tube here, so we call it also pipe. This pipe, now the egg, they transfer, now the sperm, they move for coming the egg in here. And then with the egg fertilized, now through this pipe here, so it can pass before it can inside. So, and then you get the ovary. The ovary now they store the egg. Yeah, the ovary now like the storage of the egg. And one thing I want to know is, as I've been saying, the man then they produce millions and millions of sperm in a lifetime, and they produce sperm. But women then not they produce eggs at all. Then they born with a certain amount of egg then. And some studies then say about 1 million, and some studies they talk about more, some they talk about less, but not they say 1 million. And before the woman then they see the first period, half of the egg then they disappear. And call it atresia. They disappear. Yeah, that's how nature they work. And before the woman 30-year-old, the other half, the second half of them instantly disappear. So in the lifetime of a woman, at a particular point, they get egg again. And then they're around 50-55. One very important organ, and the organ where they are the inside to the brain, yeah, they call it pituitary gland. And that gland now then can produce the messenger then. Yeah, the two important messengers I'm talking about, the LH and the FSH, and they produce, and they not only to the woman then, but also to the man then. And then LH and FSH, they are so now then they stimulate the ovary or the testes by the man for make themselves produce messenger, and for the man for make it produce sperm. So that means if their hormone there are so no day, their messenger there are so no day, then this ovary no go function fine. The other hormones then no go be produced, and the woman self no go forget pregnant. So for make una know that day, yeah. Because the next slide now, they can talk about the menstrual cycle and the pregnancy. So it's very, very important for know the organs. It's very, very important for know for the messenger. It's very important for know about the carpet. Where would they watch the next slide? Yeah. So we they talk about the woman in period, in cycle, the menstrual cycle. As I mean, say you get this FSH, the follicle stimulating hormone. The follicle stimulating hormone, now they stimulate the ovary. Yeah, that storage system. That storage system for the egg them. It is stimulate them. The way it stimulates them, it activate them thing what they call follicles. The follicles them are like the os outside the egg and the inside. We don't call them bubble. Yeah, them bubble there. They begin the FSH. They stimulate the bubble and let the bubble begin for grow. So the first of all, they choose one bubble, then the bubble or two something, and the bubble will begin grow, and the egg inside it, the egg they begin mature inside that bubble there. That this bubble also gets cells them around. With now that their cells and they produce the woman hormone, the estrogen, and the estrogen now in the increase. I will call estradiol now. The estradiol they increase, and with that estradiol increase, it affect the carpet, now the uterus. The carpet, now the uterus, they increase. They become thicker and thicker. The bubble, instead to go bigger and bigger and bigger, they produce more estradiol, more woman hormone. And then after it reach like then 20 millimeters, so 2 centimeters, the other hormone, the LH, they spike. And this information they also, where they come out from the pituitary gland up to the head, they make this bubble burst, what they call ovulation. The woman they ovulate. And the ovulation is the bubble they burst there, it release the mature egg. The egg will not mature. And then this bubble will not burst, it transform itself into what we call the yellow body. And the yellow body now in they produce the progesterone, pregnancy hormone, what I'm telling you about. The pregnancy hormone, now actually, no, it's not actually pregnancy hormone, we actually call them pro-pregnancy hormone. Maybe they call them progesterone. Yeah, and call them progesterone, it supports the pregnancy. So the pregnancy hormone they increase, and then they help the carpet for change in form, so that when the egg come, if the egg fertilize, it go able for attach panel. So that means say if this progesterone not okay, this messenger not okay, the carpet not able for convert, so that the egg go sit on panel. But then if the woman not get pregnant, if the egg not fertilize, if the woman not get sexual intercourse and it not fertilize, egg not fertilize, then this yellow body they disintegrate, they disappear. And the way it disappear, the progesterone level they decrease. And because the progesterone level decrease, the woman they bleed. So waiting woman and they bleed every month, if not every month and they bleed, now this carpet and blood. Yeah, that's very important for me. Say all this system just they for make the woman get pregnant. That means say the woman in body, nature make the woman in body, or God make the woman in body for make every month they get the opportunity for get pregnant. And if you not get pregnant, now that's make it a bleed. Yeah. So we as reproductive medicine are them, we can always ask patients and say, who still want to start for bleed? Who still did they want to start for bleed? What woman then can know, but some not can know. But it's very, very important. If you want to get pregnant, you get for no. And one thing that you get for no, because each and every doctor, when they do reproductive medicine, one for no than who say start for bleed. The other thing when they want for no is how long you period, how long did it take? Yeah. But people can say, they did every month. Okay, a good information, a fine information. But for we go like for know, we like for know the day them. a 28 day, a 30 day, yeah. Some and then they take 50 day, yeah. So yeah, if I for say month, every month or 2 months, but it's always nice for level know the day, yeah, almost days then it will take. So now make with advise patients then say, una always use a calendar. Yeah, anything we start for bleed, you mark on the calendar. Some people like mark and so when it starts for bleed small, mark 1x. When it starts for bleed small bit more, you put 2x. When it starts for bleed more, you put 3x. The way you bleed in begin less, put 2x, they put 1x. So they actually know the amount of days, because that is very important. How long you they bleed? 5 days, 7 days, 10 days. Yeah, you they get spotting in between. Yeah, so it's very, very important for make woman then know this cycle. They know say the term usai woman, this bubble the boss, generally around the 14th day. So it's very important for know that, because we know say when this bubble they almost the boss, now that's the best time for get sexual intercourse so that the woman gets pregnant. Then get test them where you can do just like the test and like a pregnancy test where woman can wet span for actually see when this LH they increase. And when this LH increase, that ovulation test is positive. And when that ovulation test positive, they about 48 hours later, yeah, the woman they ovulate. And it's also very important for know, because we know say when woman gets pregnant, when a woman ovulates, and then the woman gets sexual intercourse around that same 10 day, the sperm then they move through this tube, the fallopian tube, they meet the egg. Nayasu at the fallopian tube. That means the egg go to wait for an naya, or the sperm go to wait for the egg naya until human this bubble bursts and they ovulate. And then nayasu the fertilization will take place. And then it will take about 100 hours for make the fertilized egg reach inside the uterus, the womb, and then they are attached by this carpet. And inside this fallopian tube, so the cell they divide, say it reach inside the womb, and then it attached to this carpet. As I say, carpet, very important. If we don't thick, if we don't transform through the progesterone. So studies, some people don't do studies for see, okay, who's are the best time for get sexual intercourse? Yeah, and this one study where somebody did 2004 and find out say this 0 now the day where that bubble was, the ovulation they take place. And they don't find out say 2 days before that bubble burst, now the best time for get sexual intercourse. Yeah, if you get sexual intercourse the day where the bubble burst, yeah, you can still get pregnant, but the pregnancy rates low. But 2 days before that bubble burst, now the best time for get pregnancy. And all them points there, so why make they get different points them? That the age of the woman. That one they were young, then pregnancy rates higher. That one they were older, where they reach like then 35 to 40, the pregnancy gets lower. Yeah. So, but for all age group, the best time for get sexual intercourse not 2 days before. So people can say, so who's not the best? So then they want to get from. But then if you get intercourse 4 days before, pregnancy rate still they up. But they up like 2 days before. But the other thing we will get for know is that sexual intercourse, forget sex with your partner, not only for born Pekin, not only for get pregnant, also now for the relationship as well. And it's always nice for make when I get sexual intercourse regularly. Also for make the sperm, they renew the sperm regularly. So we do advise patients then for get sexual intercourse at least once a week. We get studies that will show say if you get sexual intercourse twice a week, the pregnancy rate might be a little bit higher. But at least once a week. And if I get patients, they will come to me, they tell me, say, oh, like once every 3 months, we get sexual intercourse, then it can be very, very difficult for me to get pregnant. And then you get others, them, where they say, I would get sexual intercourse, we get sex every day. And they say, tubaku. Yeah. I know, say, a part of enjoyment as well, but for reproduction, for make woman get pregnant, for get sexual intercourse every day, not necessary. So we will talk shortly about the pregnancy rates. Yeah, in general, the pregnancy rate is 20%. That means if 100 couple then get sexual intercourse at the right time, 2 days before that bubble burst, 20 women get pregnant. But if women younger, 20, 25, 30, up to 35, the pregnancy rate could be a little bit higher, could be up to about 30 to 30%. And if women they're older, they reach them 40, 45, then the pregnancy rate they decrease. Women that were over 45 is definitely not higher than 5%. Some studies they even say not higher than 2%. Yeah. So age they play a big role. And earlier we always believe so, oh yes, just have to do with the age of the woman, but no, now we don't realize say the man in age self play a role. As I say, yes, man then they produce sperm, fade and die, but the quality of the sperm they decrease. They get what they call defragmentation, and the DNA inside the sperm then can decrease. So yes, the age of the man also they play a role for the pregnancy rate of the woman. And then we get what we call the cumulative pregnancy rate. The cumulative pregnancy rate, now when you add different more cycles there. So if you get 100 women then with the under 35 and then take 2 cycles then, 50 of the women then go able to get pregnant if they get sexual intercourse at the right time. If you take 6 cycles, 80% can get pregnant. Yeah. And if you go higher, if you go about 12 cycles, that means like a 1 year, about 85 to 90% can get pregnant. But you still get that small amount where not can get pregnant. Yeah. And there are also studies that say even if you wait up to 5 years, you still get at least 5% will still not get pregnant. And also this cumulative pregnancy rate also age dependent, and they get for that as well. So now when it comes to the infertility, waiting na infertility. Infertility now where woman or a couple they try for get Pekin, and woman they try for get pregnant for 1 year or longer with unprotected sexual intercourse at the right fertile phase, yeah, between that 4 to 2 days before the woman ovulates, and they not get pregnant. Yeah, after 1 year. Yeah, we get something we call subfertility. I don't want to confuse you now, but subfertility, now people can use it as synonym, but actually not a synonym. Then they like if somebody they can after 6 months you know get pregnant, and then you find something we know they make the woman get pregnant, and you treat them and he gets pregnant. Yeah, but infertility, now so then define infertility. We get what we call the 30% rule. 30% rule means say the reason where the woman or that the infertility occur can be 30% the man in fault, 30% the woman in fault, 30% both, and 10% you know they see any reason why make the couple or the woman they forget pregnant. Yeah, so that means equal rights. Yeah, you get some studies them where they say okay, yes, the male cause is about 32-35%, but for make things simple, we'll put on 30-30-30. So that means we all get for no say, not to the woman in fault no more. It's very important for know that. Oh, they blame people can they blame the woman, or the woman they get Bεttεh, get them. I don't put the model or the info in the spotlight, but we get for no say not to that the woman only can get the problem, the man self can get the problem, and he also can be said both of them get the problem. So that means if we would do the examination, you get for examine both of them. Yeah, let's start with the male. And what can cause infertility in the male? Infections. You get one infection when they call mumps, when a Pekin can get them, and where that can happen, the demand is not capable for produce more sperm, enough sperm or some man they not even produce any sperm again because the testes don't unbulk. You get what they call chlamydia. That is a sexually transmitted disease. You get other one them as well, but this also can cause the tubes then for block. You get other genetic disorders. That means either you get some kind of problem from papa, or you get a problem from the mama, or you get something with what we call spontaneous mutation. That means with that cell they develop, they begin to develop, you get some mutation, which will cause demand for being infertile. Then you get lifestyle. That's very important for living more. So smoking, excessive drinking, overweight. Yeah. First time when they talk, say this concern for the woman is normal. But no, we don't studies don't show say even if the woman not they smoke, the woman not they drink, the woman or not excessive, because drinking excessively is the problem. And the woman not overweight, but the man they smoke, the drink and they overweight, and the woman in pregnancy rate is low. So it's very, very important for know that as well. And we get environmental toxins then, which can unbulk male fertility, things like plastic. You get some metals then, you know, it can get in the air, it can get in the water they drink, in food they eat. So we get for really be observe, say that can cause infertility. You get them some messenger then. If messenger they not they function properly, then you find out say the production of sperm go low, and you get some man they when they produce one at all because as I said that LH and FSH not they function properly. And then you get some medications there, some antidepressiva and some other medications there making unbulk fertility and anabolics. Yeah, that's also very, very important. You get man they would take testosterone for making them gym, for making them big. Then they say can cause infertility. Not all man with the gym they take them, but the one they take them, especially if they know they tell the woman them, and they know the woman then they get pregnant, and some they begin blame the woman them, and that's not nice. So the first thing we always advise patients then when I stop for take testosterone. They get organ-related issues then. You get some vein then that is scrotum around the testes with them big tumors that can cause infertility. And we man they will day that we mama them Bεttεh, we test this them inside our abdomen day. And then before they born, it descend inside the scrotal sac. And if it not descend inside the scrotal sac, then it can cause infertility. I make it very, very important when boy Pekin born, you for always check if he gets 2 testes. If you not get them, then there is a way for sometimes operate them and you can able for save the testes. But if you wait too late, yeah, 1 year, 2 year, 5 year, then that testis still not produce sperm anymore, and the man and it can be infertile. You get some tumors there which can also cause infertility, tumor on the prostata, tumor at the penis, or even tumor at the testis as well. If one divide the infertility in categories, we're looking at the reproductive organ, we can say, okay, if we look at the sperm, yeah, the quality of the sperm can decrease, it can cause infertility. If you look at the production, yeah, the quantity of the sperm can decrease. If you look at the pipe or the tube, them can be say the delivery decrease, or the sperm that need to be delivered because of blockage. And then you also get erectile dysfunction. That means the man in penis not the up, and if the man in penis not the up, that's okay. Also, that can also be a problem for make the woman be pregnant. Sometimes it can be something when the nerve unbulk. It can be the organ unbulk, but sometimes it can also be a psychological issue. And I make it always nice for go see doctor if you get that problem there. In the women in case, in female in case, now the same thing. You get infections them like the chlamydia, the sexually transmitted disease. And it's very, very important because if woman get down the tube, the pipe, then the two fallopian tube, then they block. And if then they block, the woman not able to get pregnant naturally. You also get genetic disorders, and as I say, lifestyle, very important, and hormone disorders, as the messenger disorders. I mean, the LH and the FSH not able to stimulate the ovary, then the bubble not will build up, and the woman will able to ovulate. You get medication, anabolics. The woman they say we can use for one for take testosterone for making them big back, that it can cause them give them problem for making them pregnant. You get one thing where people can talk about a lot, where I mentioned later, that is stress. Yeah, the studies not actually don't show say stress because infertility. Yeah, but we don't know say if, especially women, they in extreme stress. You get 3 types of extreme stress. You get where a woman never get eating disorders. Yeah, a woman will get eating disorders like and then one thing we can cause the one not forcing bleeding because the body they in stress if you get eating disorders. You can also get women that will get when they do sports, when they do extreme sports, then itself they make the body stressful. And if you get extreme sport, sometimes back in the same period, and then they can cause them for being infertile. And the third thing we don't some studies don't show that young people they will get extreme pressure at school for tests. They're in a college, mostly in a college, extreme pressure. Then self can not see them period, and that means say yes, stress can also cause infertility, and also you get organ-related infertility. And I work like for go through the organs then with Una. You get so for woman them where the man one penetrate the woman, then they get a lot of pain. Yeah, it can be organ related, it can also be psychological. If then they happen, it will be very difficult for make the woman get pregnant. You get issues with the cervix. Yeah, you can get tumors then at the cervix, for instance. You get what we call HPV, the human papilloma virus, which can cause cervical cancer, and then they can cause problem with the cervix. Sometimes you get for preterm, and if you're preterm, it will be difficult for make the woman get pregnant because sometimes you even get for pull the uterus if the cancer don't spread. You get the uterus. As I say, the two main important parts of the uterus, you get the muscle and then you get the carpet. So if you get within a lot of women in Africa can get what we call fibroid. Yeah, and that itself can actually affect pregnancy, affect the woman for getting pregnant. Or if the carpet, the join, the fasting because of infection, like that chlamydia infection, that itself can cause women not forget, for make the egg not able to attach. And the fibroid then also in time. This one where they protrude inside the uterus, they press the carpet. Yeah, if the egg they try for attach itself na yasu, it might attach, but the woman then go they miscarry. So you get a woman where they get multiple of the kind of fibroid there. So that one they where they're out of the body, like this one so they know they cause infertility. That one they where they inside the wall, it's disputable. People then can say if woman gets too much, then fibroid there. So inside the wall, then the contraction of the wall not day like how it's supposed for day, and that means that the sperm not able to move through the fallopian tube. And as I say, if you get them joint adhesions there, so inside to the carpet, then itself can cause infertility. We get some woman there, we get some kind of wall, some kind of dividing wall, either halfway or the complete through the uterus. Earlier on in the 80s and 90s and the early 2000s, we always really feel say yes, this just can cause infertility. But recent studies don't show say actually they cause infertility, but it could cause miscarriages. Yeah. But that's also there's still the debate on it, if that are true or not. But if I get patients, we don't get like a 1 or 2 miscarriage, and it gets this kind dividing wall. If you complete like a this, they're difficult for pull. But if not halfway like a this, they aim for cut and come out, and then mostly we can see say the woman can get pregnant back and miscarry. So come to the ovary. Yeah, as I say, woman then born with a certain amount of eggs. So you get some woman them we don't born with less eggs. And if that they happen, then sometimes it will reach in menopause, the egg go down by 30 or by 40 instead of by 50. You get some woman them with that degeneration process, that atresia when we talk about, once the egg then they disappear. It can be say you get some woman them with that then they go faster. Yeah, and if then they go faster, it can also cause the woman them for make the egg down before they're 50. So that means say this ovary, so it's just a storage for the egg then. Yeah, and it gets all the diseases them where the egg then they but they know they go through this process of follicle, like that the bubble not the big and the bubble not the boss. Yeah, whatever you do, they happen. Then the safety. And you get the fallopian tube. We don't talk about that. Say if the woman gets infection, then tubes they also can block, and if then tubes they also block, the woman not go able for born Pekin normally because the sperm not able to go through. And last but not least, you get the messenger then. Yeah, then we can talk about extensively. I know need for mention, but that's also very, very important for know if the woman a hormone, a messenger, then they work properly. There's one thing we get for mention, we call endometriosis. Yeah, it's kind of very difficult to explain, but I will try my best for one. Endometriosis, we are telling about the carpet with the inside the womb. Yeah, with the cloth of the womb. That carpet there, then we get tissues there, we call carpet, that carpet like tissues there. The fiber, that carpet with the inside the womb. And that tissue there, it can be in the abdomen, inside the woman belly, it can be in the bladder, also the urine there, it can be also in the ovary, that storage organ, it can be in the bowel as well. And that one then them spots then they cause inflammation. Yeah, that means if the woman is in bleeding, them spots then self they try for the discharge. And then after that, because of that, it cause for make the woman get inflammation in the areas that they. And when the woman gets inflammation in the area, it is very, very painful. Now make you get some woman them when they see them period, they get heavy, heavy pain. And if woman they see in period, it tells you say you get heavy, heavy pain, then they not normal. And we own area, we know say if something like that happen, the woman infertility rates they decrease. It decrease up to about 50% in some cases, especially if they're in an area where one reproductive organ. If you're in the ovary, or if you're inside the wall of the uterus, or if you're in the fallopian tube, and it can also cause the fallopian tube for block. So it's very, very important for let we know if woman gets this endometriosis. And so if woman come to doctor tell and say, tell the doctor say, they get extreme pain when they see in period. I mean, if you really think about endometriosis, yeah, they get to operation where they watch inside the belly with camera, they able to see if the woman get them spots there, so inside the belly. Unfortunately, you only see about 30% of the spots there. So because if they inside the uterus, or then they between the vagina and the bowel barriers and the rectum barriers, they actually see them where they do that operation. Sometimes you able to see them where they do sway scan. Yeah, like these are the ovaries. Yeah, these are the bubble that I'm telling about. Yeah, and then this year so now like at the endometriosis. So when you do ultrasound, you see this, you say, oh yeah, this also might be this endometriosis, especially when combine and with what the woman say, when the woman say get pain. Like this also, so these are the bladder, so the bladder front here, so and here so they see and say it they close to the bladder. So when you see something like that in a scan, and the woman say he gets extreme pain, we get for things about endometriosis. What we can do is, if the woman no wants to get pregnant yet, then we can just give the woman a contraceptive, yeah, pill. And most of the women, the way give that contraceptive, they get some special one as well. They're not gonna get pain again. Yeah, if they can still get the pain, we'll say, okay, we'll take the contraceptive throughout, yeah, so that you know will bleed. And if you not bleed, you know will get the pain. And then if woman get contraceptive and you not get the pain, then there are one way for sure say yes, most likely na endometriosis again. But this sickness is very, very important for making diagnosis. I'm not we get studies which show say so woman they can take up to the 15 to 19 years before they even diagnose and say it gets this endometriosis. But it's very, very important when woman come to doctor, talk about this extreme pain, we get for think about endometriosis. So now what we for do when patients come to we and say they try to get pregnant, they're not able to get pregnant. Yeah, we get different steps. The first and most important step na anamnese. Now the way how you question the patient for no waiting, get different questions them where they ask the patient and we expect the patient for answer the questions and they thoroughly and properly and also truthfully. Yeah, truthfully, I will say truthfully when I will see why I will say truthfully. Well, that's very important. We get for monitor the site. You get the vaginal ultrasound, and they do scan from the vagina. You also take blood, you able to see the messenger. There's some messenger that how the messenger they work, for see if they enough, you can able to do that. They get for also check other blood values like the HB, you go take some vitamins, and they get thyroid and prolactinus, and also two messengers that also affect pregnancy. And then, as I say, mandem, we get for check the mandem, not only for do the sperm count, we can always, especially if the sperm count not okay, it can always nice for make you watch and make a doctor inspect the man for see if everything, if the organs they're okay. Then you also get for check the tube, the fallopian tube, then pipe the one we talk about for see if the pipe them block or they're not block. So let's start with the questions. Yeah, and these are the basic questions that we're going to ask. We're going to ask about the age, the height, and the weight. As I say, the weight is very, very important for know if the patient is overweight. Lifestyle, yeah, smoking, drinking, as I've been telling about. Medical history, if you also get high blood pressure, if you get diabetes, it's also important for not day. And as I say, as I've been saying, our menstrual history is also very important. Who tell us you bleed. When you start for bleed, it's 12, with 13, with 19. Sometimes it's very important for northern as well. And how long you cycle in days. Yeah, very important in days, not in months. And also sexual history. How often you get sex, almost partner you get, when I come to the truthfulness, as having they say, how many partners you don't get before. You know, some patients think you can find not only women, also men, they can find it hard for discuss some issues there with me. I can always tell and say, no worry, your secret safe with me, because we also get the patient's doctor confidentiality. We therefore know if you don't get pregnant before, if you don't Wεll belly before, if you don't get miscarriage before. It's also very important for we. Family history, if the man or the woman, then papa, mama, grandma, papa, grandma, grandpa gets any medical history. It's also nice for them to know. Sometimes also nice for know if the mama certainly gets problem for get belly, you know, and then we also nice for know what kind of treatment you don't they get before. If you don't go to doctor before, what kind of treatment you don't get for. These are the basic questions they ask. Yeah, I mean, some of them questionnaire, they also the form they make patient can feel like it be like them 6 to 8 to 10 pages. You know, so some patients they can really feel I can feel overwhelmed for us asking questions or for answering questions. So for monitor the cycle in Germany, what we can do with the monitor the cycle 3 times. We do a vaginal scan at the start of the cycle between the 3rd and the 5th day of the cycle. We see if the carpet low. We see almost small bubbles in there. Then we take blood back. And then in the middle of the cycle, around the 12th and 14th day of the cycle, we watch of this bubble on big. And through vaginal scan, we watch if the bubble don't burst, and then we watch if this carpet don't thick as well. And then about 18 to 22 days, about 1 week after ovulation, after the bubble don't burst, we can also check back. So now the way that we would actually monitor the cycle for see if the cycle normal. Yeah, if the endometrium, the carpet, they grow like how it's supposed to grow. If the bubble, they grow like how it's supposed to grow. Sometimes, and then later on, I will tell them about sex timing, and I will tell them exactly how we do that through this cycle monitoring. We actually also do sex timing for tell patients when exactly they forget sexual intercourse. So as I said, demanding these 5 parameter then are the most important parameter for we. The last 2 they are also not too important for we, but we will therefore know almost liquid demand they ejaculate, almost a million sperms then day per milliliter. Yeah, and almost a million sperms day all in all. Yeah, suppose it's at the cutoff values then. Yeah, the volume now 1.5 milliliters at least for B. It's supposed to be at least 15 million per milliliter. Total amount of sperm supposed to be about 39 or over 39 million. One ejaculate, you imagine of 39 million sperm, they go fertilize 1 egg. Yeah, and then you get the motility, the movement of the sperm, the one that will move forward, supposed to be at least 32%. The sperm, the way how the sperm look, the one would look fine, supposed to be at least 4%. Yeah, now the WHO now being given criteria there. So there is a new one now, 2021, where then they do so moderate changes. Like for instance, this motility, they don't change it from 32%, they don't change it to 30%, because we don't actually find out say in the last 50 years the sperm count actually don't decrease. I mean, it's then the people that attributed it to environmental factors, but we're not too sure. But it's really amazing how the sperm count don't increase, they don't decrease in the last 50 years. Other diagnostic, as I say, they can do operation, yeah, then go through the navel with a camera, and then you actually see the abdomen. You see the lining of the uterus, you see the lining of the bladder, you see the tube, and then you can inject some kind of blue solution inside the womb, and the blue solution they go through the tube, and it actually say where they cut out into the abdomen, so you can know say the tube's free. Yeah, and this now the diagnostic will we they recommend in Germany. That's we they do in Germany. Unfortunately, I don't think we get an alone. And we actually go for also see if the woman gets fibroid, for instance, if the woman get that endometriosis, that carpet one they tell you about we can get out of the body, carpet like tissues we can get out of the body. You can actually see them when you do the laparoscopy. And you get some woman there we not want forget operation. Then you get other options. You get 2 options. Then this one, whether his hysterosalpingography, this salon, and also this one definitely this salon, where they actually put a tube into the uterus, and then you inject a fluid, and then you do an X-ray. Yeah, do an X-ray, and then you just see whether this fluid they flow through the tubes. Then you actually see the tube because of the X-ray. So like this way also they show say this one tube block, yeah, and the other one open. Yeah, but this year, so we know they do in Germany, but I know say this one also the salon. And what they do in Germany is when I get operation, they put a tube inside the uterus, and then we inject fluid inside the uterus, and at the same time we do the vaginal scan. We do the vaginal scan, they see the fluid the way they flow, and then you will know whether the tubes are free or not. So this way also we do in Germany, and I hope say we were able to at least introduce this also na salon in the near future. So we come to the prevention and treatment. Prevention, that's simple. Prevention, you have to stop for smoke. You have to reduce your weight if you're overweight, yeah, by eating healthy food and exercising. That's very, very important. The exercising is also very, very important. We advise patients then for, especially if you're overweight, for exercise half an hour every day, or at least 150 minutes per week. That means half an hour every day for 5 days, and then you do 2 days break, and you eat healthy food. And that's very important. We get patients that we get which we can call PCOS, polycystic ovary syndrome, and then women then they can also get what we call insulin resistance, and because of that they gain weight. They go say, doctor, I know they eat boku, but still they gain weight. Yeah, I can always say most likely now because you get this PCOS, and you get to where I will check the blood for see if that's true, if you get the PCOS, and then I can always tell and say yes, and you get the PCOS, you get the insulin resistance. Now this is what we do. We can always advise patients for space out the meal. Yeah, by the woman that we get insulin resistance, we always tell them say, when I eat only twice a day, in the morning at 10 o'clock and in the evening at 6 p.m. And then in between for drinking a lot of fluid, a lot of water. And the one thing Solomon like na soft drink. Soft drink, before avoid soft drink. Soft drink gets too much sugar. Always advise patients for drink at least, not only women, but also men, for drink at least 2 to 3 liters of water a day. Yeah, you get a lot of people who can complain of headaches. Yeah, and you actually find out say the urine is very concentrated. And if urine is very concentrated, that means you don't get a lot of fluid. People think, oh, I get headache. Now I go to the doctor, give me drip. As I get drip no more, I don't feel better. Yeah, if you drink water, you will feel better as well. Because they're the same thing. So 2 to 3 liters of water every day, eat healthy food and exercise. Avoid STDs, but partner them on the male side or the female side, or for left-handed, for making no contract STDs. And as I say, stress, yeah, it's disputed, but it's advisable also to avoid stress. So treatments, we get what we call expectant, sex time. I mean, shown that the graph. What we can do is we can actually monitor the cycle, see whether the bubble don't big, and when the bubble don't big, you tell patient and say, go home, go get sexual intercourse. Because sometimes, especially if we know if nothing very wrong for the man or the woman, then it can be the problem. Why make woman already get pregnant? Yeah, because they know they get sexual intercourse at the right time. You know, so we always advise patients and say, please have sexual intercourse at the right time. So I make we test them 1 month, 2 months, 3 months through this sex time. Then one day way that bubble not develop fine. Yeah, we can stimulate them. We get where they give medicine. Yeah, salon, I think so we get what they call clomid. Clomid can cause the follicle or the bubble for grow. You get other medications, but it's very, very important for make doctor examine you whilst you take the medicine. Not only for give the patient the medicine and tell the patient say try am for 6 months. Very, very wrong, because if you do that day, it can be say the woman they develop 3, 4, 5 bubble. And if you develop that much bubble day, then you could get triplets, quadruplets, and then they no good. So we always advise patients and say, please, or doctors then say, if una dey give the patient that medicine day, una a controller. Now, controller make regular ultrasound, scan regularly for see whether you get only 1 or 2. You also get injections that we can give the patients, and you also get injections where they give the patient for make the bubble burst, yeah, for make the woman ovulate. So where we can do that, we can do the scan. We don't say, oh, the bubble don't go big. We can give an injection for make it ovulate, for make the bubble burst, and then we tell them to let them go home and get sexual intercourse, because we will get the injection. We expect them for ovulate latest 48 hours later. Operations, yeah, if then get the fibroid, you have to remove the fibroid. If you get that endometriosis, you have to remove the endometriosis, and then it can cause the patient for make the pregnancy rate also increase. So if we get then two, especially then 2 things there, so you can either for operate them for removal. If you find out say the tubes and block, you get some doctors that really try for open the tubes, but in beyond case, we can always tell patients that say, well, if the tubes and block, it's better for find another source for get pregnant. And I will explain to them later. You get what we call insemination, in vitro and intracytoplasmic sperm injection. I was showing a diagrams concerning that very soon. But coming back to expectant and follicle stimulation ovulation, we give the patient the tablet at the start of the month. If a tablet we give them from the 3rd day of the cycle to the 7th of the cycle, only 5 days, not longer. And then we do the ultrasound, as I say, at the start of the cycle. Then we do the ultrasound at the middle, on the 10th, 11th day of the cycle. And if we see the follicle, then we give them the injection, let her ovulate. Insemination, we get what we call insemination. Insemination we can do, like for instance, if the woman then gets that endometriosis, what they talk about, especially if they get that inside the wall of the womb, or if the cervix tight and we know say it could difficult for make sperm go through. That's very seldom anyway. You get women that want me say get problem for get sexual intercourse and they get a lot of pain, or you get man them, they forget sexual intercourse, but then they're able to masturbate and ejaculate. If that is the case, then we can tell the man, we can do this, we monitor the cycle as well, look when the bubble they form, and then the man they give you sperm, and then we prepare the sperm, the fluid with the man give we, and we inject it into the womb of the woman. Then the sperm will go through the tubes. That means if we don't check if the tubes are free, go through the tubes and the fertilization will take place as we say, as we read on top of. The pregnancy rate will increase the pregnancy rate to the normal pregnancy rate. That means if your pregnancy rate of the pregnancy, if you have 35 years, pregnancy rate is about 30 to 35%, then we know so we don't increase the pregnancy rate to that amount there. Yeah, so these are the first step we could do, especially if we get some patients them or get some couples them, we don't try the expectant, the sex timing and in our work. And then we can do these because sometimes we can assume say most likely they get sexual intercourse the time we actually tell them for get sexual intercourse. So we advise them and say, okay, let's do the insemination, and then sometimes it can work. IVF and ICSI, the in vitro fertilization, the intracytoplasmic sperm injection, which we can do today, we can stimulate the woman, make the woman in follicle, make the woman develop more follicle length, like then 6 to 15 follicles, and then we do the ultrasound, and we begin puncture the bubbles. We puncture the bubbles, and we remove the egg. Then we remove the egg. Then they would do in both cases, and then we would remove the egg. We get the IVF. We would put the sperm and egg together. Then the sperm will fertilize the egg, and then you get the ICSI, where especially if the man in sperm count really low, we will not say it's very, very impossible for him to get pregnant, or you get some man that will not get sperm at all. Then we take the sperm from the testes, we inject them directly inside the egg, And then when it gets fertilized, we let them develop from 3 to 5 days, and then we inject the fertilized egg inside the womb for making it attach now on this carpet. So then we can always do if, like for instance, the tubes then block. If the tubes then block, they're actually able to take the egg then from here, you fertilize it out of the body, and then you inject the egg directly inside the body for making it attach at the carpet at the end of the endometrium. So that is reproductive medicine. As I try to keep them basic, because we can actually use each and every topic. We can actually make a whole session on each and every topic. On the diagnosis, we can hold a whole session on the treatment. You can hold a whole session on just endometriosis, or we can hold a whole session on just the fibroid. But I just try to keep them basic for make una understand. But there is one fun fact where I want to share with una. And the fun fact is that una stop for blame una wife or una daughter-in-law we do not get the boy Pekin. We know say not only in our culture, other cultures them as well, a lot of blame on the woman, say the woman not even forget boy Pekin. But not the woman fault at all. Then we get to know that because for sure now you get on the man inside the X and Y chromosome. Yeah, that means say one sperm they contain one sex chromosome. The one will be the X, and the one sperm will be the Y. The woman not get Y. The woman only get 2 X. So that means the one egg they get X, the other egg they get X. That's why they divide them. So that means if one X sperm meets one X egg, a girl picking the come up. If one Y sperm meets one X egg, my boy picking the come out. So what we can say is that now God they decide. Yeah, that one with the up here now. Then they decide if my boy picking or girl picking the come. But if you want to make blame, do you not blame that woman? Because that woman not get one saying in whether a boy picking or a girl picking the come out. That is a very, very important thing for me to know, so that we are not going to blame, we wife them, and we daughter-in-law them because they not get boy picking. That they not supposed for, nowadays, that is supposed to be an issue, but we are the CNMA practice, say it's still an issue. What are the take-home message? Take-home message is you get for live a healthy or adapt a healthy lifestyle. You have to get a healthy sexual life. Avoid STDs, very important. Infertility, very complex. So that means a specialist supposed for handle them. And most importantly, if you try for get pregnant and you don't try for 6 months, at most 1 year, and you don't get pregnant, then please go see a doctor. No wait 3 years, 4 years, 5 years. Yeah, it's very important for make you go as early as possible for let them go check first. And when they check, then finally say you're okay, they can still continue for try. But no wait, I get one patient wait 20 years, 20 years, you know, and that's not acceptable. Yeah, but because people do not get that information, now it make it be very, very difficult for make the woman be no say yes. You get that opportunity for come to doctor. But when I don't get that information now, and I hope say I'm not going to use the information wisely. I thank you all for listening.
Thank you very much, Dr. Bell. Wonderful session. Before we move the floor open now for when I ask questions. Even though Dr. Bell don't squash one of the myths already, we have the feature. I feel that the pattern woman they pull, now they make a the bomb boy picking. Now you don't know to that day. Look at for don't go bluff say, and then they make a bomb boy picking. Anyway, family them. At the time this follow we ask question. Dr. Bell don't go through the session. I get one question already where somebody we don't ask. He say, for let you give an overview of polycystic ovary syndrome. I'm not to the not to the session we will deal with, but if they ask about say you just give an overview of what's in the cause and place. while I look at the other questions. Dr. Bell?
Yes. At the time I watch the question, I not see the question. Wait,
No. It had a chat to say if you can able to give an overview of polycystic ovary syndrome.
Okay. Yeah. Well, yeah. As I say, it's apparently we can do in a whole session, but basically, polycystic ovary syndrome na kind of I don't know if we call it disease or a disease where very, very difficult for interpreters or forget the definition. But we can always say you're supposed to get at least 2 of 3 things then. One, cycle can be very irregular. Sometimes women they take 60 days, 70 days, they're not seeing a cycle. Secondly, the man hormone, we get the messenger in the body. Some of the women can get a higher level of the male hormone, testosterone, and also other male hormones. Yeah. And then thirdly, if you do ultrasound, you scan, when they do vaginal scan, they see the ovary, the storage organ, and they see small bubble there. Then bubble one in the top. Small one. They're all there like a kind round the ovary. So if you get 2 of them treating them, then they can say you get polycystic ovary syndrome. So the picture, that ultrasound picture, then they call polycystic ovary. Yeah, but it's actually wrong. The name actually also wrong because not a cyst you get. Now actually small follicles them, small bubble them, and if you only get dandy, but you don't get the other 2, then you don't get PCOS. Yeah, and then PCOS also associated with what we call the insulin resistance. Yeah, that means the woman then they gain weight because of the insulin resistance. And if woman gets that PCOS, the main medicine we can give weight sometimes mostly can work at the clomid. But as I say, Danny, for be very careful because sometimes women can react highly to that. You will get 4 or 5 follicles, but you get on the other hand, you get other women where they react at all. You give them 3 tablets for 5 days, and they react at all. Then they get to think of other ways. You get other injection that we can give the woman them. Yeah, but sometimes the main issue is that the woman for lose weight. We actually know say people them we get this PCOS, then they also gain weight, and so now like a vicious cycle. Yeah, so one thing, because we don't know waiting they cause waiting, but we always know say most of them patients if they lose weight, sometimes the cycle can become regular, and then they can get pregnant naturally. Yeah.
Okay. Thank you very much, sir. Dr. Weber pay very good compliment, and everybody pay compliment to a wonderful session. You see, even for old brain, you bring back a lot of memories. Thank you very much, sir. I will go to Olabisi Claudius Cole. If you unmute yourself, please. Olabisi. Okay. We never hear you. I don't know what happened. Dr. Patrick Coker.
Yeah. Hello.
Yes, sir.
Yeah. Good evening.
Good evening, sir.
Hello.
Yeah. As I said in my chat, I have to congratulate the presenter. That was brilliant, as Dr. Weber says. Even for us old folks, it brings back memories of our university days. But I'm a family physician. I'm not a gynecologist. But what surprises me, it might be because you are in Germany, is that you seem to be doing your investigations, etc., either male or female. One of the things I try to do is to encourage both partners to be at my surgery, even from the onset. And I think that somehow helps. It's not always possible, I agree with you, but most of the time you find out that the success rate is even better when you have them both from the beginning. Because you have this scenario when, of course, if it's not possible, you do all your investigations possible out here for the female, and then she's okay, and then she comes and tells you, well, my man say, like what you say, me know they can because I've been not get one picking before, which might not even be the case for reasons. But I just want to know your own comment about having both partners together from the onset.
Yes, no, we serve in Germany, and we do that. We do that. We make sure the couple then come together. Yeah, because it's very, very important for make the man, as I say, that 30% rule for make the man self not say that he could also be the problem. So we also they investigate, they do the investigation on both sides simultaneously. We also get patients that we can come and talk, say, oh, my man say, okay, everything, I don't get no problem. They make you always tell and say, well, I will tell you, man, say, myself no say okay. I will we prove unto you. We two as man, one for the prove unto the woman say yes, he okay. So tell you, man, say, let it come, let we prove unto you, say you okay. Because we say we as man, we until we man, then we no say okay, but we prove unto you, woman. And then there's another thing we can do. Like if the man really, really no one come, we can we can watch when the woman they ovulate. And then we tell her, say, go get sexual intercourse. And then come 8 to 12 hours after that. And when you come 8 to 12 hours after that, you'll be able to take slime from the cervix, on that area when they're at the beginning of the uterus, of the womb. You take cervix there and they watch under the microscope. If sperm then still move. That I can tell and say, bring your man with you. When I want to discuss something with her. So we can now, we actually find out, say, if we see, say, non-sperm not daily or very few sperm daily, I take the man and say, look, you see, the reason why I make our level check your sperm, I know you just get sexual intercourse yesterday night with your woman, sperm no day, and I make our one level check. And then most of the time, the man can decide, say, okay, yes, let we check. So man, I don't get one man was very angry. He say we corner her. I said, well, we get for show you say you have to come, and most of the men then can participate after that, after we do that post-coital test.
I got one suggestion. Why make I want to tell the man say, well, when I get tell and say, well, we'll never go to hospital. And if we not go, you know they get nothing else. That they go to get and go there.
No, until not can work.
I get a question. Somebody they asked say if IBS can cause infertility.
IBS?
No, IBS, irritable bowel syndrome.
Well, it can be associated with other things. Yeah, because we don't find out, say, you get a lot of people that we get some immune disorder. And if people can get that immune disorder, we can find out, say, most of them can also get this endometriosis. So that means, say, mostly that bowel syndrome they cause infertility, but something else. Maybe it gets endometriosis, or maybe it gets other immune problem, we can maybe, because that's very seldom. Yeah, and then we can also check them, but we check them after we don't see no other reason. Then we can check the immunity and know if maybe that the problem than they why making it. Because you can realize, say, the woman pregnancy is a wonderful thing, very wonderful thing, but it's also something that what do I call it? Different body for the woman in body. So the woman can reject her, you know. So that means God make the nature make her in such a way so that the woman go able to accept that different body there, and he gets pregnant. Then can get problem because their immunity very high.
Okay. Thank you very much. Yes.
Sorry. Let me get Doc for stop sharing, please. Let me see yourself.
Okay.
Oh, okay.
Another question is somebody asked why what they cause heavy painful menstrual period, you know. Which they cause the heavy and painful period pains basically. Which they cause for them get heavy period and also very painful. Which they cause them.
Yes.
I know so we don't touch on something like this before where Dr. Ture been deal with, you know, but you know, for the benefit of the one who not been there, if we can able to touch on that. Dr. Ture, if you have one step in, please let know.
Yes. As I don't say, you get this what we call endometriosis. Yeah. Then one thing we definitely they cause woman for the heavy period pain. Yeah, endometriosis. And that what about that carpet with the out of the body. Yeah. If somebody gets heavy period pain, it's nice for make we know if he gets that carpet with the out of the body, because you get fibroid as well. Fibroid we can cause also heavy period pain and also heavy bleeding. Where you get so it's also important for know if patients then they bleed. When they bleed more than, because they can say to bleed more than 3 to 5 days. If they bleed 10 days, 15 days, it actually knows so well, most likely that person they get fibroid and they can also get pain because of the fibroid. But mostly now this endometriosis can cause that.
Okay.
Just for support that, waiting Dr. say.
Yeah, Dr. Kamal.
In the young people, them, you know, then they will just begin the woman business, the cycle. So tending they mostly in hormonal problems, you know, hormonal imbalance thinking because they will tend the period not settled properly yet. Then they will begin bleeding in between and it be painful. That's not one thing. But somebody very don't they in 30s and in 40s, mostly like how Dr. Kahneman are more to do with the fibroids mainly, and then of course the endometriosis and things like that. So if it happen, and I think it not been happened before, it's fine for let you get investigated. There's no questions about that. You know, not a normal thing for let you to go through that kind of thing and the way you know we don't go through them. At the very beginning of your period as a woman, you can get dentin, but once you settle towards the middle or the end, then enough for the happen. And of course, if you don't do perimenopausal, as I say, somebody who don't do between 45 and 55, you know, or you don't pass menopause, the period don't dawn, now you begin to see more, clearly not a good sign. And so you get to keep an eye on that. And if that they happen, they advise to you and for see you primary physician if you did outside England. If not England, you did Nigerian practitioner, then go direct you to the right people, then the guy go see you and investigate you and do exactly what's necessary for you. Thank you for that.
Thank you very much, sir. Dr. Rashid, you say you get a question, but I don't know which one are you now. You cannot see name. Oh, there you are. Dr. Rashid?
Yes, sir.
Yes, go ahead, sir.
All right. Doctor, you say the best time for the woman get Bẹtteh now 2 days for that intercourse, 2 days before the bubble bursts. The question is, how the woman will know say the bubble will burst in 2 days time, or how you will know say the bubble don't burst today? What are the signs and the symptoms for let woman know say the bubble don't burst?
Yeah, very good, very good question. And the nature that nature put in a few things them were very interesting. But I first of all, we got to know say not to all women they able for recognize that. But one thing where women they during in cycle at one particular point in day where it gets some kind discharge, it gets some kind very transparent discharge, and then if you touch the discharge, you make and so they draw like an okra. Dandy, if you get dandy, now the right stem dandy for make you get sexual intercourse, for get pregnant. And sometimes as well, if the woman really they recognize in body, they know in body, they actually find out say in libido and the feeling for making get sex, they increase around them period and day back. Yeah, I always tell people, I always tell my patients and say, I can't talk about reproductive medicine and I don't talk about sexuality. When I the two main things then and day where woman can able for do, able for recognize, for no say, okay, this is not the right point for me to get sexual intercourse. And what they also very interesting, we get two studies them where I will talk about. One, we get some doctors in Germany, only in Germany or Holland, where they go to disco and say, I want check for see if we they able for know if either they ovulate or either not they ovulate. So they ask young women them, they will be willing for talk about them period, which day of them period, then they note them down and then they actually look for see how they dress. They actually find out, say the woman the way they close to the ovulation date, then dress more freely or more yeah, I went to more I don't know what call it in English, but more open, I think.
More relaxed.
More relaxed. I mean, what the way how they dress more relaxed, not like glass, more relaxed than those that when they close to the ovulation. And that's very interesting. Yeah. And then it's also so that you get places them, unfortunately, places in the world where people they accept contraceptives, or the man they say no, my wife not go take no contraceptive, and so and the woman they get pregnant every year, every 2 years, and the woman don't like that, don't want that. And you get some people there when they actually teach the women and they for check for that slime day. Check for the slime. As the slime begin to go, say, okay, this is not the time where I not forget sexual intercourse. Because if I get sexual intercourse at that time, I might get pregnant. So they actually teach the women for do that day. And then, yes, the women they get sexual intercourse, but then they get sexual intercourse at that time day. So then they get pregnant. So if you walk that way, then definitely could walk the other way around as well. And that's kind of really interesting. And I always tell my patient then two things then they for make them know say yes, then therefore actually try for look them body and know and learn more about their body, and sometimes that they can help. But then on the other hand, if you actually try and you don't know, then you also get that test. You also get that ovulation test, where they actually know if they can't ovulate, and then so this is not the right time for get sexual intercourse. And then you get some people when at temperature and they measure. Yeah, they can measure the temperature, but then as the temperature increase, that means you don't ovulate. Yeah, so the mistake that people they make, then they use that temperature, then they measure that temperature, they measure that temperature. And but when we measure the temperature, that means you don't ovulate already. That means you proof say you don't ovulate, but then you don't too late for me to get sexual intercourse.
Thank you very much, bro. At least you don't teach me. What can go clubbing. So if you see baby they can close to when I want to say if you see enter, bam. And if the temperature they rise a bit, if you know say already it's for balance. Not so we see that doctor so. I get another question. I can't see Dr. Kama. I get another question. Somebody asked, what it can cause for a woman see the period twice in 1 month?
You get different reasons. One reason is that it can be say you cycle on shorter. Yeah, you get some women they weigh, especially when they go over 40, over 45, you cycle the change. Yeah, and then you actually you bubble, they grow in the second phase of the cycle. And when the bubble don't go in the second phase of the cycle, you will bleed, and then 14 days later you will bleed back. So that means a dancing can be a sign say something me egg reserve not that much. But then you get other women them where they get small spotting in the middle of the cycle. Then they show say the estrogen, the female hormone, the female messenger, not high like I supposed for high. That is a problem in the cycle. And if there's a problem in the cycle, then we can advise patients then for take that clomid under you get for check the woman, and then it can also cause people then for bleed. But and then you get all the different, like for instance, if you get the fibroid they inside the uterus, or you get what they call polyp. That means that the carpets don't it gets some kind attachment, yeah. Then itself can cause women therefore bleed. Or then thirdly, the way how women can bleed irregularly. Now it can be get for be with say that the uterus, that the carpets they bleed. It can be say that the cervix, yeah. You get a certain kind of cells, it's a lining with the out of the cervix, within the vagina, out of the cervix, and you get another lining with the inside the cervix. And this lining with the inside the cervix, it can take her out of the cervix, and then so woman can get a big normal. It's normal, especially when women get high estrogen, you can get dandy, but most of the women in the way they get sexual intercourse and they bleed. And then when they bleed, they can really scared. Then I can do the watch inside the vagina. I see say, okay, no, this is how you get. But definitely you get to make sure say that dandy and the thing, and not so cervical cancer, because cervical cancer can cause that as well.
Thank you very much. We get so many questions. I got about 5 people there and they up. I saw come first. Olabisi Claudius Cole, let's try for see if I can able to get you back. Gonna hit it first on the list. Yeah. Olabisi? I don't know.
Hello. Yes.
Oh, here we go. Yes.
Okay. Thank you very much. Thank you very much, Dr. Bell. That has been really refreshing. My question, actually, sorry, I go to KRIO. Some practices and the way some women do. A lot of women they do where one for find out whether or not that they affects them fertility. One of them is a lot of them go tell you say immediately after sex, then they go to toilets and they go wet. And some of them, as you see them done sex, so then they go wash themselves. Then the other practice, which is very, very common amongst we women them, when they wash every morning, or when they wash, then they use them panties with the soap and water, then wash themselves inside the vagina. I can ask and say whose business and therefore do inside it. Then they say I think it can also cause maybe the hostile vagina, I don't know, changes the pH. Maybe you can educate us about that. And then another common practice is that boku women then they take antibiotics after them periods. It's very, very common. So then practice that amongst we women and very, very common. So I want to know if they affect infertility. Thank you very much.
Oh, that's brilliant. Thank you, Dr. Bell. Just before you take that, I guess you will join this one day too. You know the one way something the way someone want get Bεtteh. They believe say way they don't do the business done and therefore left them foot up, raise them up, or maybe put on a wall or put pillow. Say because they want to let all the small don't let go back down. So they are touch on all of that in one go. Thank you very much.
Yeah. Yes. For wash. Generally, for wash the vagina generally is very wrong, because the vagina gets its own milieu, and anytime you wash the vagina, and if you wash it with soap, even if you wash it with water, it's wrong. You can wash outside. It's very important also for wash outside for get a good hygiene. But you're not supposed to wash inside your vagina, because through that the milieu not good enough for the sperm. Yeah, because the sperm need a certain amount of pH for making able for survive. And what's really interesting as well, as I've been telling you about that slime where they be formed in the middle of the cycle, then a very good slime for the sperm. So if they watch that slime they come out, then the sperm they're not gonna live long. I'm not gonna talk say go get pregnant. Yeah, I would just say your pregnancy rate go very low. That means you might get pregnant, but it might take a while for you to get pregnant. So it's very important not for wash your vagina, enough for if you get sexual intercourse, no, enough for go wash. If either you can wash outside, because you get something in the way the sperm can they flow out back, And then for women, they feel uncomfortable, yeah, you can wash outside, yeah, but don't ever wash inside your vagina, because your vagina gets ion, you get which I can always call the good bacteria then. And if you destroy them good bacteria, then they now are the bad bacteria that they go, and then they get them fungi, then where past stuff will go, and people then go begin get infection. And taking antibiotics when you see period, not necessary. Yeah, you could get patients there. We have a lot of patients them where they can get, especially if they get sexual intercourse, they can always get this burning feeling. Yeah, that means that the milieu inside the vagina are not good anymore. Yeah, so that then you get for him for try for cultivate for make you get medicine we can give them where you put it in the vagina for actually for develop the good flora of the vagina. So raising your leg after sexual intercourse not necessary. Inside Germany also back you get a lot of female magazines that we can recommend that, but it's definitely not necessary because the sperm they go through the cervix into the vagina through gravity. You know, definitely not. Yeah. Waiting, we believe it can happen, but it's not scientifically proven. But if we think about logic, you get for realize, say, you have the muscles of the uterus, and women them you also get orgasm, and a lot of people think they feel so, oh, the woman in orgasm not necessary. The woman in orgasm is necessary. What can talk to a patient about that? Yeah, I got one patient where as I tell her that woman starts for cry. I say, now what's happening? So because I'll not ever get orgasm. I say, no, that not means you know get pregnant, but it's a support for move the sperm, because you forget that the sperm they're really small, and the distance we then get for move up to the fallopian tube, outside then they go meet the egg. Then a distance standing, and then sperm they know they're able to move that distance there. So the contraction of the uterus, they help for move the sperm to outside it's supposed to go, not gravity. So that means if they put your foot up, not for nothing. Yeah. And as I say, the uterus they contract regularly, just like how we bow ourselves, they contract regularly. But during the orgasm of the woman, the uterus they contract some more. So that, and if you find out, say, with women they get the orgasm, it also they produce fluid, and that fluid is now a very good situation, very good milieu for the sperm as well. You know, so that means before you go strain yourself or put your foot up, the best thing I can always advise patients, so now try forget another orgasm. Yeah, the best time for making the woman get the orgasm now during ejaculation. When the man they ejaculate, if the woman herself gets orgasm at the same time, then it actually they able to pull up the sperm into the uterus as a way of supporting it. Yeah. So that means I not advise any patient for any woman for beginning to do gymnastics after sex.
Thank you very much, boy, for the journey. You remember that journey, a long journey, and I make a fast swing in real life. I've been there for run very fast for that make come. Yes, Dr. Kamara. Yes, sir. That's your contribution, sir.
No, not the contribution. I just want to let Doc maybe amplify a couple of things. I tell you what, this part will really not fail with. You know, thank you so much for that. I think as we saying, we look up our lands, you know, anchor the piece. We go for answer and encore. There's no questions about that. However, there's two things I want to let Doc please clarify for you. One, the difference between subfertility and infertility as a burning problem, the burning issue where a lot of people have not understand the difference between subfertility and infertility. That's one. Two, yeah, we Marabu people and get this business if, as Doc been talk earlier, allude to them, say, if you know born boy Pekin, then that's it. Then get for good friend, you know, after 20, 30 years of marriage, get for friend young woman who can born boy Pekin. Now, the understanding is perhaps then get certain foods, then get certain the frequency of the doing of mama and papa business, all that they affect. I think the agility of the sperm. Now, whether that would determine the sex of the child or not, God one know. But if I'm for we get the understanding as to whether certain foods go actually help that, maybe the frequency, because as you say, if you do it too often, maybe 4 times, 5 times in 2 days or 3 days, or 1 day, when clearly, you just the hamburger because you can't get anything from that. But if I for we get that balance, and if for we get that balance, if I for we know which kind of food we go eat, we go up. But it's nice also for us to understand which is the difference between subfertility and infertility. And I think that is very, very important for let people know. Again, important for let people know waiting happen to the man where the man says itself in your body can fight against them, where in sperm not able for actually get woman belly. Not to because a low number, but just to get antibodies by body where they cause that problem for them. So I think the doc need for highlight today for let people understand that. Because I know say spiritually in Islam, we know say, and a man them when them with them in the born boy, girl picking them, they leave you me, then they go bury them alive. That's the heinous thing we are man to do. And I tell you what, I don't want to be religious in this case, but I know full well that that's not the worst thing anybody can ever do. Because you don't get the right sex where you want, you go bury woman alive. And because of that, then get for go judge them on the day of judgment. So it's clear for let we get this thing clear. Say, do ya? Let we left for the blame, we sister them, we picking them, we mama them say they born girl picking and not born boy picking. The essence of getting boy picking, now the man says get them. Because now when you get the X and the Y, now you go get the boy picking. The woman gets XX, the man get XY. If now X meet up X, now girl picking. If now Y meet up X, now boy picking. So why blame the woman when now you serve the man, now you know put the two when now the boy picking? So let me get this clear, please. Thank you so much.
Thank you very much, Doc.
Yes, infertility and subfertility. That's it's very, very difficult for explaining difference. It is, as I mean, say for the infertility, that's how we define them. Say if person they try to get pregnant in the space of 1 year and they get sexual intercourse at the right time and they don't get pregnant, and they call it infertility. There are some teachings which say no. That is not actually infertility, that you can call it subfertility. But subfertility, we can look subfertility in the sense that, especially if you know the reason why make the person not get pregnant, and then you're able for 3 times and he gets pregnant, then that was subfertility. Yeah. So that means it's like it's kind of really confusing, but infertility is actually if somebody not able to get pregnant at all. So at the end of the day, if somebody comes to me and then I tell them the definition of the infertility, then I can always tell them and say, but we go read them, you will go read them like I will say, they get pregnant at all. No, not like the case. If I look at like I will say, you come to me because you forget pregnant, so me they call it infertility. But then if I ever find the reason why we can get pregnant and you get pregnant, then it wasn't infertility, then it was subfertility. So that means that making confusing a lot for patients then. But I so make it explain to the patient, they make them understand that. That when the boy picking and girl picking, I don't talk about time, you don't talk extensively about time, and it's very, very important. First of all, in this day and age, there's no difference. Then one thing and the way for no now. I mean, forget boy picking or forget girl picking. There's no difference. I mean, you go to think yourself. I mean, waiting at the reason, waiting so important for make I get boy picking, and I can get patients way, especially because honestly speaking, to only man they come and tell me that. There's a lot of women where they come and tell me that. Yeah? Then I can always tell and say, okay, first of all, tell me the reason why make you think the boy picking important. Yeah. Or me man wants boy picking order. If I don't get boy picking, then the family there. Then go look me funny, and the man go find other with. Then I will tell us. Then I will explain to them the issue. Then I will say, you see, it's not your problem. It's not your fault. Yeah. And then if you, at the end of the day, if you watch everything, you want to say, okay, I mean, tell me waiting that the advantage of the boy picking in a society. And then you can watch me. And they can find out, say, they don't know. I mean, waiting are the benefits for make that person where they born a boy and not a girl. There is no benefits, because that same girl picking day can grow up and do the same thing with the boy picking they do. So why is it that important? You know? So sometimes you actually trigger some thoughts in some patients and some people them when they say, yeah, not two, I don't get patients that don't come. They get 4 or 5 girl picking. They don't get 3 or 4 cesarean sections, but still and they get all the pregnancy normal. Then they come to me now for maybe we can do IVF because they are boy picking. Yeah. Fortunately enough, in Germany, they allow that because you can do them actually. You can actually check the sex before you give the egg back to the woman. But in Germany, they don't allow that at all. But you get some content with that. But it's definitely not important, and it has nothing to do with medicine. And if you explain to people, about 70 to 80% of people they understand that, but you will still get a small group of people who are not going to understand that. And for me, I always say it's sad.
Thank you very much, sir. A question from Dr. Weber is say, is there a comparative evidence score of fertility between the Caucasian and Black people?
Difference? No. We only assume. We only assume, say, we own cases. Okay, on the one hand, they say the sperm count, the decrease in sperm count, in sperm quality in the European world, in the Western world, is higher than in Africa. So if Nadandi try to say, well, you can assume, say, well, yeah, maybe the pregnancy or the fertility gets higher in Africa. But and on the other hand, they always think that, oh, in Africa, the women and they get picking them even when they're older. But it's not actually scientifically, it hasn't been scientifically proven, because on the one hand, you don't want to say, okay, it's the age where the person get on the right age. You don't know. You will say, oh, my mama, you won't pick away 55. Like, okay, maybe I don't will ever tell a man that one thing, and they will always say, I don't ever tell a man, say, they ever get pregnant, because me to God. Yeah. But if somebody comes to me and say, you sabi somebody we born picking away 55, I will say, go ask her if I again use. But yeah, there are some people who say that there is a difference. It's not been scientifically proven. I would really like to see if we will get sometimes somebody will go do that kind of study there, but I think it will be very difficult for see. I see a paper. I think Dr. Kamara a topic on BBC when they talk about it's really sad. Most of the instruments and like we talk about the pulse oximeter is actually being produced for the Caucasian and not for the black skin, for instance. So there's not much study on that side there. So I hope and pray we go able for go our countries them and maybe do them kind of studies and they for proof or not proof that fact in it.
Thank you very much, sir. I get a few questions. I know so we don't run out of time. And one for them now, which are the long-term side effects of IUD coil? And will that cause, as part of that long-term side effect, would infertility be part of that?
IUD, it's a very good thing, especially for women that will know how to take pills. We advise patients that if they get IUD, therefore remove after 5 years. Some patients they unfortunately can forget. But if you remove after 5 years, you get some when after 3 years, you get some when are just copper, and you get some when we get hormone panam. And the copper, you can say you can use longer, but I can still advise patients they pull after 5 years because it is a a foreign this is a foreign body, and foreign body can cause inflammation. It can cause inflammation after some time. But studies show now, say for at least 5 years, it's okay. Definitely we'll get a group of women where might react more. We get a group of women where actually put the coil and they get so much pain because they used to go they accept them and they contract, they remove them. Yeah. But that's one of the best way where women can for protecting self so they don't get pregnant. But in generally, we will say no, they affect fertility if you use them properly. And if the doctors insert them properly, because sometimes if you don't get infection already and you insert them with the infection, then it can make it worse. So normally it's a good thing if inserted properly and used properly.
But what about the link with fibroid? Is there any link? Is there a scientific or medical evidence to link the two?
No. That one there, if you get the then coil in there, especially the one with the hormone, which is just again the hormone, then it can even help self against fibroid. First time we say, oh, if woman get fibroid, no again the coil no go protect them much from pregnancy. But now you actually know, say, if especially the one with not especially the one with hormone, with gestagen, can actually make the fibroid go smaller. Or people that will get as of that endometriosis, where if you get that in the wall of the uterus, then self can use the coil, the one with the hormone, and then they can also help. You can put them for a while. Then if you don't get pregnant, they can use that. But definitely, that is not a make you get fibroid.
Okay, thank you very much, sir. I will go to Kojo Keru. I don't know if that doctor.
Yeah, Dr. Kojo Keru.
Okay. Hello, doctor. Sorry about that. I only see Kojo Keru. I don't see. Yeah, go ahead, sir. Is that Keru? Dr. Keru?
Yes, good evening, everyone.
How are you, sir?
Good evening.
Hello, can you hear me?
Ahead, sir. Yes, sir.
Yeah.
Yes, can you hear me?
Yeah.
Yes, sir.
Can you hear me?
Yeah, Kojo, we hear you.
Yes. We hear you,
fantastic. Sir. I want to tell Dr. Bell, thank you for such a good presentation, and and it's a very good subject for us, family physicians, and I'm so happy to see quite a few of the family physicians, prominent family physicians around, Dr. Patrick Coker, Dr. Olabisi Claudius Cole, and others. Because this is a very common problem, over the past 30 years in this country, or 30, 40 years in this country, we actually see a lot more problems of infertility or subfertility. And this goes across the board in other countries as well. So for that matter, it did not become a problem in family medicine. That is the general practitioner, as you will call, because it is in the general practitioner's clinic where then they can make them kind of complain here. Then eventually we can refer to the gynecologists and obstetricians. But then we've had problem in managing such patients because of the lack of expertise and equipment on ground. And we've been done make arrangements with Eco Hospital in Lagos, and but then we were overtaken by Ebola So everything went into the back burners. But then I wonder how Dr. Bell go arrange for coordinate with, doctors who are seeing patients here in Freetown, especially family physicians, so that we can work together as team, for address woman them problems in this area also in, with regards subfertility and infertility. That's one side. The other side is a contribution. One thing we suspect, say, now the reason why we get such high incidence of, it's just one of the reasons, high incidence of, subfertility in this, in these few decades, is the increase in amount of toxins in our environment, whether toxins in the food, toxins in the drinks, toxins in the, in the air. In fact, no wonder then they talk about removing diesel vehicles in the streets in Europe. You see, but we don't have that kind of luxury in this part of the world. In fact, you can drive, and when you drive around town, you see the amount of vehicles, trucks and lorries and cars where a lot of exhaust fumes they come out pan, and they just drive around like that. And those are things that affect the human being. It's not just for fertility, but the problem of toxins affecting the fertility of our patients, is another interesting thing that we've seen. And there are now with the in West Africa now, integrative medicine has been recognized, and we are also looking at alternative and complementary methods vis-a-vis what you call it, subfertility and infertility.
Yeah.
I wonder what Dr. Bell go say about that.
Thank you very much, Doctor. Yeah, Dr. Bell, over to you.
Yes, it's I make a mention before, say environmental toxins also they play a big role in infertility and subfertility, and it's very for in Africa, because we not get the different way for measure certain toxins them. It's difficult for make we know if they affect we males, the women them and woman them now. But if we see within the development like Europe and in America, you will also, well, definitely if then they try to reduce the amount of toxins in the air, and then we they get that kind of way more amount than Africa, we will not say yet that might could affect you, but we know in the situation where we're able for regulating them properly, unfortunately, and we're not able for get studies where for prove them, for make we tell people and say, okay, this is it. We always get for use the one way they do in Europe and use them in Africa, but are they hoping to say one fine day we go able for also get we own data, and then able for advise governments and other stakeholders them for reduce the toxins them, not only in the air but also in our water supply, food supply, and also about plastic, and the heating of plastic. For put plastic in a microwave, and actually they affect male fertility, and they don't prove that as well. It's very difficult for get that through to people then, but I hope and pray say it will one day at least the government or at least some organizations will pick them up and sensitize people then more. Now, doctors also supposed to do that. Concerning working with family doctors in Sierra Leone, if Well, Bodi Betteh pass Gentri allow me, I'll go just show one slide. This slide. Me and me daddy, Dr. Tilly Bell, create this Yares Fertility Consultancy. Yares Fertility Consultancy, the first virtual fertility consultancy in Sierra Leone, where people can go on the website, register, and definitely, I would say that there's always going to be a fee. Me, I'm not being paid. I consult patients them. That means they go download the form, fill the form, send them back to me and pay the fee to Yares Fertility Consultancy, and they will make an appointment, and then I discuss the form with them. Because as I say, 50% of the diagnosis sometimes already in the questionnaire already. So if we don't know, they don't fill the questionnaire, we don't talk about the questionnaire, the consultation, they go for about 45 minutes. Then we try for family doctors, them, especially somebody we go get the vaginal ultrasound, where they go able to monitor the cycle, and also we don't try to get contact with the clinic where we go able to do the hysterosalpingography, and with the hope and praise we go able to introduce the hysterosalpingosonography in a salon. And then, because I think that's the first step. The first step is the diagnostic. Yeah. First step is the consultation, talk to the patient, explain to owners today, part of honor, they explain to the patients, then let them know exactly when for the sexual intercourse, and then do the diagnostic. And maybe, like for instance, if the tubes them free, the tubes are not free, the tubes them block, or the male sperm count is very, very low, then they get the opportunity for go to Ghana, or for go to, I get contact with a clinic in Nigeria, I get a contact with this clinic in Spain. I try to get with the contact with the clinic in America, and with my clinic, the clinic will say me to work in Germany, patient in Canada. So if we then go to the IVF or the ICSI. And also in the Mano River Union, there is no fertility clinic and no IVF clinic. You have to go to Ghana or Nigeria or Senegal, you get clinic there. And at the moment, for open a fertility clinic in Sierra Leone, it's too expensive. We have to first of all see whether we have the number of patients, because we need at least 100 patients, IVF patients, them for running a clinic. And if you don't have that, the best thing we can do is to collaborate with other clinics in the sub-region. But as I said, the first and most important thing is the consultation, the questionnaire, and the diagnostic.
Yep, thank you very much, sir. One question we Auntie Vic be ask, you say if endometriosis is a lifetime problem.
Yeah, if you get endometriosis, we're going to call it a chronic disease. And the endometriosis, the be, I said, okay, we'll use something before doing that. Bodi Betteh percent low notes down it down. Maybe we'll go make a session on endometriosis. Because endometriosis, like chronic disease, now the female hormone, they actually trigger the development of endometriosis. And people then can say, okay, we get people that way and say it's genetic, because it gets a woman there and say, we all know family, we all done that, so we normal for level get pain or bigger. And say, no, pain not normal. And so you're gonna say, okay, this might be genetic, so there's a component of genetic in it. And even if you do the operation and you remove all them, as I said, in carpet, they pull all, the probability for making it come back there. So first of all, we always tell patients and say, if they're not ready for get pregnant, then advisable for operate them. The best thing for doing now for just take the contraceptive that is supposed to help. And if you want to get pregnant, then nice for look for see if you get time. If you get time, then remove her. But I think say Bodi Betteh pass Gentri, not turn it down. Maybe I will do a whole session on endometriosis.
I can't wait. Thank you very much, sir. Staffing, are you gonna be the last question I will take? I get two more where I will just blend together because I know they don't really stay really long. When it don't look like a good session where everybody they enjoy. So Staffy, yes, boss. Staffy?
Yes. Hello.
Yes.
Yes, so Mima, I do thank you very much for this session.
Yes, you're welcome.
You know, it was very, very nice. And I even get somebody with me now, a Nigerian, but he understands everything perfectly.
Okay.
Because it was really straightforward and simple where the layman self can understand. I guess somebody where he say make I ask this question for him. They use this coil. But since he start for use this coil, they get in menstruation for over like 7 to 8 days, and the blood they flow too much.
Yeah.
So you don't ask the doctor. He say yeah, it's normal, but it's over a year now.
Oh, that's too long.
They continue. So now make I say okay, make I ask this question. What do you feel say that person can do?
Yeah, we know say this coil can cause bleeding. It can cause also spotting. And that means even in the middle of the cycle, woman can get them. But we can always say in the space of 3 to 6 months, it's supposed to subside. And if you don't go up to 1 year, then get to where how you can say, okay, well, let will give the key another contraceptive we will take for like a reset button. They actually gear the contraceptive because most likely you get the carpet, the endometrium inside the uterus. We know they actually bleed off properly, so they can say, okay, well, fine. We'll do like a restart button, left the coil first, give the patient 1 or 2 months contraceptive, and then see what's in the happen. And if it continue, you get for removal. Because it can be say it gets something else. It can be say most likely it gets fibroid. Let me say the coil not in the cause the bleeding, but at the fibroid, or the polyp that was something where they can grow from the carpet, from the endometrium. And if you do ultrasound, you actually see the coil, then you actually see if you get the other thing then. And if you get this fibroid inside the uterus, when it causes the bleeding, then we can tell patient and say, okay, well, we remove the coil first, remove the fibroid, and then put the coil back, a different coil.
Okay, thank you very much. Danke schön.
Yeah.
Danke schön.
Thank you very much, sir. The last 2 questions, a better way to quarter. You really don't talk for long. Well done. The last 2 questions is one we will talk about the woman enough for us, don't gender. Basically somebody they see, well, if they not wash the night they make it smell. Then the other side of the question is that why make a woman and can get pregnant longer than 9 months, which can cause that.
Okay. The smell, where women can smell, they get some particular bacteria that we get inside the vagina, where they cause that smell. They get some kind, they can smell like fish smell. We call it Gardnerella vaginalis. Then about 40% of the women get some maybe no sense they get some. And some they can get and they can cause it. That means say the milieu de flora that the vagina not okay. So, and if you wash them, you wash your vagina, they make a worse. My vicious cycle. So, surely, we think you advise patients to do. First of all, now for check, they get swaps. When I ask you to, they will get a swab test. They will send them going to lab for see if you get them, and then if you get them, and it affects you, especially if you get a smelly, then they can treat them. Either treat her with antibiotics or make you actually refrain from antibiotics. I can try first and get some kind suppositorium where they put it in the vagina. We know to antibiotics first, see if that they go like a kind of disinfect the vagina, and then they actually kill the bad bacteria and they kill the good one back. So you can do that there for like 6 days. Then after that, now you get to put another suppositorium. We go able to support the development of the good bacteria. Then, yeah. Now that I can do, and that itself can help sometimes, but some women it can actually chronic. You do them, but then it come back. You don't come back. Then we can say, okay, we got to check the partner to see if there's a problem in that area there as well. And then we can also treat the partner. We can treat both of them then with antibiotics, and then we don't treat all with antibiotics, and then you give the woman now this suppositorium for make the good bacteria then develop, but then they get longer. You can get them for about a month or more. But when they see them bleeding, they will stop and then they continue back. But washing the vagina is really wrong. Then if you not take anything out of this, it's very, very important to say outside, yeah, before us. That's very, very important. But inside the vagina, no, you're not supposed to wash it.
So about the pregnancy one, why leak someone and you take?
Yeah, well, it depends on the body. It depends on the body, but long past 9 months day, but we are talking about only a few weeks, more than 9 months. We can go to doctor. We don't go over 9 months. Then you're supposed for try for make sure say the baby healthy. You know, try for make sure say for make the woman for induce the contractions so that the woman go born. But it's just biology. You know, you get something in the way, so woman then can stay pregnant a bit longer. So I get a really interesting story from Daddy where our woman came to Ram and he done the 12, I think about 11 to 12 months, saying a Bεttεh. And Bεttεh big so. Daddy say, Daddy tell us definitely that not to Bεttεh. And then that's if actually find out not to Bεttεh, it was a really big fibroid. Really big fibroid where he may have operate and pull. It was, I think that was the biggest fibroid in Sierra Leone. I know surprised if like the biggest fibroid in Sierra Leone in those days, in the 90s. And so, yeah, you got some patients that they make it feel say they're pregnant, but they're not pregnant, and definitely you have to go to doctor because of that.
Thank you very much, Dr. Bell. I'll get another question, but a young man question, so then I will take them offline. Some of the young men already had gone. That's what I talk about when it comes to about for what and not for what gender. Certain questions I don't get on my phone, but I will keep them there. I will talk to you about that. Separate. I don't say it will be appropriate for that. I'm asking a question. And that's how you smile. I know they talk, not by force. No, I know they do. Thank you very much, sir. I want to say thank you very much to all the audience. When I really don't do well, when I don't stay on for the whole show, thank you very much, Tona. Dr. Today, Dr. Rashid, and Dr. Kamara, and etc. Thank you very much, Tona all. And Dr. Bell, I will give you just one last word for later because we really don't stay long. I will give everybody one last word. So, Dr. Bell, which I take home message for people?
Yeah, so the take home message is therefore maintain a healthy life. That's very, very important, and avoid boku partner, avoid sexual transmitted diseases. Also, as I don't say, the one main important thing that if when I try to get pregnant, and when I forget pregnant, at least in 6 months, at most 1 year, go to doctor. Yeah, and if you're older, especially if you don't reach them 40 or they go over 40, 6 months have long. Yeah, because definitely in your case you might take a longer time before you get pregnant, because pregnancy gets low. So if you get a partner and you want to try at least 3 months and you're still over 40 and you don't get pregnant, at least let them go do the diagnostic. Then go check the man in sperm, then go check your cycle. Yeah, and if all things okay, and you say, okay, we're not gonna continue for try. But if things are not okay, then you know say, okay, well, at least we don't waste 10 for get the proper treatment. Yeah. And with my family in a salon, we they pray God say more diagnostic way for Canada country. We did in the process for develop that, and we hope and pray say in like one to 2 years we will able to establish something tangible for the people in Asylum.
Thank you very much, sir. My family, thank you, dear. If I miss anybody in question, my sincere apologies. I ignore. But as I know, when I see the session, it be very, very interesting, and everybody they enjoy themselves. And I thank you very much. And we look forward to soon again in a fortnight. You take home message. Well, Bodi, Betteh pass Gentri. We'll see you again. Good night.
Yeah. Good night.
Wow.